Welcome back to the Daily Dope Show, where you get the dope on the shit that's going on in the drug war. If you like it, subscribe. Um, I also have t-shirts for sale. Check it out in the description. All right. I do these clips about the opioid epidemic and nobody ever watches them, but I still do them because this is some heavily important stuff. So we have a 14-year trend of rising opioid deaths reversed in Colorado after marijuana legalization. This sounds like some pretty good shit. Since recreational marijuana sales began in Colorado in January 2014, the state has seen a 6% drop in the opioid deaths, according to research published in the American Journal of Public Health. The drop follows 14 years of rising opioid deaths, going back to the first year for which the researchers had a data. That suggests yet another argument for marijuana legalizations. Pot might stem and even reverse some of the trends unleashed by Americans' decade-long drug war. This should all be directed right at Chris Christie, who's in charge of the Opioid Commission, and basically who threw away 8,000 comments about marijuana helping people out of the opioid mess that they were in, or doctors talking about how the people that they've prescribed marijuana off the opioids. So the federal government's obsession with marijuana, for example, stymied research into its use as a pain reliever, helping to create the conditions for the so-called opioid epidemic. That's just one thing that the government did to basically fuck you into opioids. I got a whole nother video coming up about, Marino, Tom Marino, Trump's pick for for the drug czar, and how he had to back out. Yeah, we're going to do the full story on that pretty soon. So Trump, he looks to set to double. Wait, President Trump looks set to double down on his failed tough on crime approach to opioids, reportedly planning to declare the opioid crisis a national emergency. But it's the drug war that's the problem. A shift in attitudes could go a long way to combat opioid use in a way that strong arm tactics never can. Quote, legalization of cannabis in Colorado was associated with short-term reduction in opioid-related deaths. The American Journal of Public Health paper concludes, as additional data becomes available, research should replicate these analyses in other states with legal recreational cannabis. Washington, which legalized recreational marijuana by ballot initiative in 2012, did not see its first recreational marijuana shops open until July 2014. Since then, recreational marijuana has been legalized via ballot initiative in Alaska, Oregon, California, Nevada, Maine, and Massachusetts, and via the legislature in Vermont. None of these states have yet to have legal marijuana sales for as long as Colorado did for the research study. A connection between easier access to marijuana and lower opioid deaths has been explored before, however. A 2014 study found that from 1999 to 2010, states that had medical cannabis laws had nearly 25% lower mean annual opioid overdose mortality rates than states that prohibited medical cannabis. Quote, because chronic pain is a major indication for medical cannabis, those researchers wrote, laws that establish access to medical cannabis may change overdose mortality related to opioid analgesics in states that have enacted them. And it's true. We've seen study after study say this shit. But of course, for some reason, Colorado officials are skeptical about the new study finding that legal marijuana reduced opioid deaths. Of course they are. Now remember, before I even tell you about it, these are the same people that are out there saying, you know what? Since Colorado legalized marijuana, there's been more crashes out on the highway. So that has to be because of legalized marijuana, even though they're not even talking about what the tests are of people that are doing the crashes. And if they are, they say, oh, more marijuana in these guys that are driving and crashing, and these people that are crashing into people have marijuana in their system. Well, that's because they have it stays in your system for like 30 days. Anyway, and finally, they also use this correlative bullshit. I've seen these same people do it. Auto insurance claims have gone up since marijuana was legalized in Colorado. So that has to mean more people are driving stoned and they're crashing because they're stoned. marijuana has nothing to do with this auto insurance claims things, but somehow those are all good enough correlations to say that their shit is, what they're saying is true and we should worry about it. But when you tell them something like this, it just bounces right off them. So officials in Colorado met the study with skepticism Monday. Dr. Larry Wolk, an executive director of the Colorado Department of Public Health and Environment, said it's too soon to draw sweeping conclusions about legalization's impact. Oh, really? You guys have been legal for almost 5 years, man. Well, 4 years. What the fuck more do you need to look at? There was a 17-year trend of opioid deaths increasing every year, and now it's going the other way by 6%, and you're going to act like that's nothing? You can't blame that on any kind of weed thing? Whatever, man. It just hasn't been in place long enough. Anything that does get published at this point should be considered preliminary data. All right, here's the preliminary data. More people are getting prescribed, or less people are getting prescribed opioids, less people are dying from opioids, less people are dying from heroin than they did before in Colorado because legal marijuana is readily available and people, I guess, aren't really as prone to just getting like fucked up on heroin. I don't know. But you see this everywhere where marijuana is more accessible. Opioid use goes down. Is it a coincidence? I don't think so, dude. You can already say that your opioid use went down in Colorado. We've seen the studies in 2015, 2016, and this year where they said that people they're using opioids less, they're getting prescribed less opioids, and there's less deaths from opioid overdoses in Colorado since marijuana was legalized, but even before that, since medical marijuana was legalized. We've seen all these studies come out from different organizations and different government entities, including Colorado Department of Public Health and Environment. Their own studies have said this about medical marijuana. So anyway, Robert Volek, who coordinates the Colorado Consortium for Prescription Drug Abuse Prevention, said there are too many factors at work in the state's opioid death trends to isolate the impact of one policy change. Sure, buddy. In other words, since this is your actual job, you're like, whoa, don't tell me what my job is. I'll tell you how it worked. Quote, the whole thing is so convoluted with so many different things going on in the marketplace, it's virtually impossible to assign cause and effect and credit and blame to any one thing. Well, if you say so. But Wolk and Volek said the correlation is too simple. In addition to the stronger monitoring program, these are all the things they're saying. Well, this is why the opioids is going down. It's because of these things here that we did. So they have a stronger monitoring program. 2014 also saw increased public education about the dangers of opioid prescribing and wider distribution of the overdose reversing drug naloxone. Now, just because it's an overdose reversing drug, they're saying, okay, well, we got less deaths because people are just getting saved on the spot. No, we're counting overdoses, not just deaths. Okay, so if you use a naloxone and someone didn't die, that still counts as a fucking overdose. And by the way, naloxone in itself isn't some kind of a strategy to combat the opioid problem. If you can't just use your logical brain, you saved somebody's life that would have died, so that person might still be on opioids, and then B, it didn't prevent somebody from becoming an addict anyway in the first place. It doesn't do anything to deter future use or any of that. It just saves you from dying when you overdose. That's it. So, it's not like distributing that wider is going to cause opioid use to go down or whatever. And it definitely, if it's going to help prevent opioid deaths, that's great, but not 6%, not that big. And all these other things put together, you got to at least give weed a little bit of credit, dude. You guys in your own papers wrote that medical marijuana caused deaths to go down. So now all of a sudden legalizing recreational doesn't? Whatever. The Colorado Consortium for Prescription Drug Abuse Prevention, which brings doctors, pharmacists, policy officials, and others together, was also just getting up to speed. Volek also noted that even as prescription opioid deaths have fallen, deaths from heroin have been rising in Colorado, meaning it is impossible that what appears to be progress in combating prescription drug addiction is actually just a large scale switch to a different opiate. Now, I think when you look at all the overall numbers have gone down for everything. Now, when you say what you're saying is right, and that's because they've been limiting the prescriptions that people get on opioids. Like you couldn't now you have to go to the doctor every time you want a refill or something. It used to be you could get like three or four. You could get a year's worth of refills. Um, and doctors are there's a lot of that has to do with the doctors cracking down. Oh, what was the numbers there? Sorry, I kind of I wanted to do that earlier. So the number heroin deaths have risen 23%, but the thing is the heroin death number was lower. You're talking about thousands versus hundreds here. All right. So you fell from 472 to 442. That's not, I hate when they use percents because it always throws you off. It's like, what are you talking about percents? And where's the numbers for opioids? I'm sure that number is thousands. Like you can. Oh no, here it is. Okay, so maybe I'm wrong on that one. But again, this drop to me, you gotta credit weed a little bit because this is pills that people would normally, if you had the choice to get prescribed pills or get medical marijuana for, after a tooth surgery or a fucking car accident, people would know, and we've seen the numbers, pick weed. So, and that's if it's available. So whatever, man. These guys might have a point with some of the things they're saying, but give weed some credit. And if you do get credit for all this other stuff that you did, just remember that if nothing else, you staved off the tide of the rising. Everybody wants the answer now because we want to know if this is a good idea or not. But the truth is, we don't have the answer, and it's going to be a while until the jury comes back in. I think if you need to, what you need to do is embrace it and find people that are, that it worked for, and find people that it didn't work for, and talk to them. Not enough. We don't do enough talking to the actual people that are affected by this shit. Of course, in this society, we want to demonize them, call them junkies and all this other shit. But this is just where we're at. Yeah, the opioid epidemic, it's not a very sexy story to cover, but any positive news that we can get is, welcomed. And when somebody says, hey, we can make a correlation between, marijuana and something positive happening, like opioid deaths going down, the first thing people want to do is be like, oh no, don't give marijuana any credit. And, it's sad. It's disingenuous. You're not thinking with empathy. You're thinking with ego and gravitas, and you're just acting like you're, especially these people that went to medical school and they're doctors, and they're just like, oh, please, marijuana, give me a break. You guys act like that's some kind of a miracle cure-all or something. And it's like, you don't even give it a chance, all right? You don't even want to look at the data, let alone scrutinize the data from the point of view that it actually might work. Try that sometimes. See if that helps you. I don't know. That's all I got for this. Like I said, if you like this shit, subscribe, man. I'm going to make stories out of the opioid epidemic until, I don't know. And there's no really solving this problem, to be honest, but we can at least make it so it's not just crippling communities. I mean, there's got to be ways to go about it. And if you want to know what I think we need to look to Portugal, where they have seen a 75% decrease in the number of addicts since they legalized drugs. And that's heroin addicts, and that's opioid addicts, and that's crystal meth addicts, and that's people that were addicted to crack and cocaine. Don't worry about marijuana because nobody's fucking out there like suffering super bad because they're addicted to marijuana. All right.